All right, welcome to the MP546 Global Issues in Suicide course. I'm Henry Carlson, and I'm sitting here with my friend and Jesse Akins. So, Jesse, we're diving into some tough territory today. It's global trends in suicide, right? Now, before I get lost in the weeds, let me just say, the numbers are kind of staggering once you really dig into the World Health Organization's data. The differences between regions, Africa, Southeast Asia, the Americas, they're not what you'd expect.
Yeah, it's honestly, when you look at that WHO interactive map, it just kind of stops you for a second. The suicide rates in Africa, for example, are really high. There's this report by Deutsche in 2019 that stuck with me, just how much depression and lack of resources affect some of those regions. And then in Southeast Asia, India stands out like big time. It's the country with the highest suicide rate in that region, which Gupta talked about. I mean, it's a lot to wrap your head around.
Exactly. And I think what's wild is how context matters so much, like why these rates are what they are. So, in Africa, there's often a lack of mental health infrastructure, right? We're talking about stigma, limited access to care. And then with India, we're looking at a mix of socioeconomic stressors, rapid change, and sometimes just, honestly, crushing expectations. I hope I'm remembering that right from reading Gupta.
No, you're spot on, Henry. And I have to say, as a Canadian, when I first found out that Canada's suicide rate is actually pretty high among wealthier countries, I was, honestly, a little blindsided. It always felt like, we have universal health care, we like to say we look out for each other, all that stuff. But Canada's numbers are up there. So I started looking at what might be driving it. Isolation in northern communities? Yes. But also the impact on Indigenous communities. There's a really complex history of trauma there, which just makes things harder. Sorry, I'm rambling.
No, not rambling at all, Jesse. I feel like that's kind of the core thing that keeps coming up no matter the region. Every country's got these really local factors, history, economics, culture, that shape the statistics. And then you dig a little deeper, it's not just about bad numbers. It's a story of people and systems either failing or just struggling to keep up. That leads us into what people are doing about it, the global response. There's these huge frameworks like the Zero Suicide Strategy, which gets a lot of attention in the States, and the CDC's Preventing Suicide Technical Package. Stone and colleagues really spell out what works, things like improving detection, training staff, and offering follow-up care. But it's, not just about having a policy, it's what you actually do at the local level that matters.
Exactly, and the evidence matters too, right? Like, the zero suicide approach is built on the idea that suicide is never inevitable for someone. So care systems are supposed to build these, safety nets, systems for assessment, stronger engagement, and really solid follow-up. The CDC's package, same sort of thing, but it adds stuff about reducing access to lethal means and building community connectedness. These aren't just checklists. These are the evidence-based building blocks that can actually lower suicide rates if they're applied seriously.
And then, when we look internationally, I'm always fascinated by how different places adapt the big ideas. So, for instance, in Los Angeles, where Jesse, you actually work, there's the Youth Suicide Prevention Project. It's not about copying the frameworks word for word. It's about tweaking them to fit the reality on the ground, right?
Yeah, exactly. So for me, as a childcare worker here in LA, a lot of what we see is tied to school-based prevention. Early intervention is honestly huge. The project here encourages teachers and counselors to spot signs early, connect kids to mental health resources, and create more supportive environments. And maybe it sounds simple, but having someone in the school setting who actually listens and follows through, I've seen it make a difference.
Meanwhile, you've got these efforts like PIPS in Northern Ireland. Different continent, different culture, but same idea. Community urgency, peer support, and accessible crisis intervention. It's about creating safe spaces, giving people other folks to talk to. There's a universality to that, even though the shape it takes is totally different depending on where you land.
Which I think just proves how there's no one-size-fits-all model for suicide prevention. We'll keep digging into these ideas and share more about global suicidology throughout the course. In the meantime, Henry, always good talking with you.
Same to you, Jesse. Bye for now.